Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, coronavirus cases in the Philippines continue to rise as the country breaches the 30,000 mark. Also, the government is assessing the COVID-19 response in Cebu City due to the alarming increase of new coronavirus cases there. And as we further ease restrictions in many parts of the country, can we prevent a second wave of infection? COVID-19 Task Force Special Advisor Ted Herbosa joins us live. And more transportation options are now available for commuters starting today. Transportation Department Senior Consultant Bert Swansing tells us more live. The country's COVID-19 cases have crossed the 30,000 mark. On Sunday, the Health Department recorded 653 new infections. 415 were fresh, while 238 were part of the agency's backlog. 266 of the new cases were registered in Central Visayas, where Cebu is located. Amid local developments and the resurgence of cases abroad, like in Beijing and Seoul, the World Health Organization warned that the world has entered a new and dangerous phase of the coronavirus pandemic. Let's go straight to the source of the story. We have National Task Force on COVID-19 Special Advisor, Dr. Ted Herbosa. Dr. Herbosa, welcome to the show. It's good to see you again.
Thank you very much, Pinky, and good morning to all the televiewers. It's great to be back at the source after several years.
Thank you for your time. The WHO said that the coronavirus is now on what it calls a new and dangerous phase. When you heard this, was this concerning for you?
Yes, of course. It's really truly a pandemic of a proportion that we've never seen in history, very similar to 1918 of the Spanish influenza pandemic. And we need to be on guard, continue to on guard. In terms of making all our public health measures work so that the transmission can be slowed down and less people can die from COVID-19.
Very complex situation we have all over the world, Doc, because it recorded 150,000 cases in one day. I believe that was last Saturday. And that would be the most in a single day. And if we actually move forward, you have Italy's health ministry saying that there seems to be a new transmission in Rome. Beijing also reported cases, 50,000 deaths in Brazil. What is going on?
And we have a new outbreak in the city of Cebu that's overtaking the numbers that we have in Metro Manila. So we're looking where we're testing more. The fact is, all over the world, we're doing more tests. In the Philippines, that's what we have done. We have tried to increase the number of COVID testing facilities since we started in March. And to date, we are now pushing like 15,000 tests per day. And of course, you'll have a concomitant increase of positive cases. However, you have to look at the positive rate of infection. So of the many tests, of the 15,000, only 5% are positive. So I think yesterday was quite alarmed quite many because of the high number of confirmed or positive cases, both new and fresh. And I think what's important is there were also many that were tested negative. So that's what's important. And when we test the positive, we identify them, we isolate them, we quarantine them, and make sure there is no continued transmission. This is the way to actually stop the transmission in our country.
Are you saying, Dr. Bosa, that asahan na po natin yung pagtaas ng number dito po sa Pilipinas because of the increase in the testing capacity at 15,000 now? I just want to go back to the latest figures 30,000 cases, that's 653 new cases. And among the 653, you have 415 fresh. So ang dami na po nung fresh, ito yung bago, the past 3 days. And then the 238 were considered the late cases.
Okay, the fresh cases tells you about our turnaround time from the laboratory. It's very important that the test result being brought out are immediately known to the people so that we can do what is called contact tracing. The later they come, that is not good for the community because we are inadvertently making them uh, transmit during the days that they are not yet known to be confirmed. So it's very important that isolation happens immediately after they are confirmed as tested positive. So I'm happy there are now more cases turning in the first 3 days after the test. And this is because we're able to do more tests. So the backlog is decreasing. Now, what's important is really people knowing that we are able to trace all their contacts. If you turn out positive, we search
Yeah.
all the people that you intermingled with at the home, at the workplace, where you went, and be able to either quarantine them and test them as well, depending on what is needed. This is the way to fight it. I think the formula of Vietnam was this: they built very many testing centers in a
Right.
very fast pace, and they did meticulous contact tracing. So again, that will be our goal, no,
Isolation.
to contact trace all these positive cases happening. It's really scary, the Department of Health reports a daily number, but that's a raw number. Epidemiologists will look at the trends. What is more important is the trend. So if you look at the number in terms of the number of population, so we're actually reaching something like 5.7 thousand per million tests being done. So I think that's already reaching part of the tests being done by other countries.
So when people question or are concerned that possibly we may have shifted too soon to GCQ, do you think that's a fair assessment that there's concern, considering that we're looking at these numbers and to some, Doc Ted, no, we look at the numbers and we're saying pataas pa rin ang pataas yung number of infections.
Okay, I think there's a misconception that GCQ will stop the virus. It does not. No, the virus is still there. We just slow down its transmission by lowering the mobility of people and for the virus to transfer from one person to another. But you do the community quarantine or you do those measures so that the health system can catch up. So what was that? We didn't have enough testing
Mm-mm.
center before. Our positivity rate in late March was something like 14% of those tested. So that's very high. Today it's like 5%. So we're testing enough. But I still like to see more tests, no, being done. So the community centers also, you built it during the time that there was community quarantine. We repurposed several facilities, World Trade Center, big stadiums, to be able to accept and isolate people.
Mm-mm.
Because, like for example, in Cebu, we just discovered that they had about 5,000 confirmed in the past few weeks, and about 2,000 were sent home for community quarantine. Now, we don't know of the 2,000 sent home to do community quarantine really had good facilities at home. If they have a big house with a single room with its own toilet, probably transmission will be minimized or really minimal and the quarantine is followed. But if you're in a household with lots of people and you have common toilet facilities and the
Right.
quarantine, the isolation can't be done, you end up with more transmission, and that's a fact already. There are publications to show there are more infections happening in the household than in the public sphere space. Yes, Pinky.
Yeah, so we need to talk about that, Doc, because there are more cases now in Cebu City. It's actually overtaken Quezon City, hindi ho ba? The question really is why the upsurge? We're going to talk about that right after the break. We'll be right back. You're watching The Source on CNN Philippines. Our guest today, COVID-19 Task Force Advisor, Dr. Ted Herbosa. Doc Ted, the situation in Cebu, frankly, to you, all right, to you, sir, nagulat ho ba kayo dun sa nangyari doon?
Yes, we
All right,
visited
I think
Cebu
Doc
just
Ted is
before
fixing. Oh, there you go.
just before June 15. We actually visited Cebu to check out the situation there because we saw the increasing number of cases in Talisay and Cebu City. And we did interview the people from the hospitals, and we found that the hospitals were already being burdened with the number of cases being admitted. We even had a case of a barangay captain that couldn't find a hospital bed. So the situation was really showing the truth that there were indeed many cases. Alisai City had a very high mortality rate. About the case fatality rate was something like 11%. So it was very alarming because it was a very small place. The facilities were still being constructed. There were three big facilities. Only one was still being used, and when we visited, the other one was ready to be used. They built very nice Bayanihan Center facilities with negative pressure. So they were catching up, but I think they were caught up in the GCQ. The transmission increased in the high density areas. These were the population area. These were the areas where
Mm-mm.
the population and land area was much more. So we decided that we recommended an ECQ, a return to enhanced community quarantine for the city of Cebu, and a modified enhanced community quarantine for the city of Talisay, which was a very densely populated area with very high case fatality and many of the lower socioeconomic classes living in very dense and communities where the population was very close together.
But isn't it also true that the reason for the increase in cases is because of the number of tests being conducted as well?
Correct. They reported that as soon as they had an increasing number of cases, they even conducted rapid antibody testing, about 45,000. That's why they were able to pick up these people. They also did, they have two molecular laboratories, the TB Research Laboratory of Department of Health Region 7 and the molecular laboratory at the Vicente Soto Memorial Medical Center, the hospital of DOH at that region. And there are, I think, two or three more private hospitals that are also building their molecular laboratories, waiting to be accredited and given a license. I think the Red Cross was also building a center there. So these are the contributions to the number of testing. We just need to go back to enhanced community quarantine because of the increasing number. The hospitals were already
Yeah,
full. I think four private hospitals were, and
right.
even you saw on the internet in social media, they had pictures of hospital beds outside the door of a specific hospital.
Oh,
That really signifies people who are going there say, "Oops, there are no more beds in this hospital," because you had two beds at the doorway of
mm-mm.
the emergency room, and that was circulating, and
Okay.
there were private people showing pictures of how crowded the emergency rooms were. So that's the current situation. I do hope they're able to control with the ECQ. The ECQ is to help them again lower transmission.
Yeah, right. And breathe.
Yes,
Allow, of course, the hospitals to not be overwhelmed and breathe as well. I mean, that's the same thing that happened here in Metro Manila. The hospitals were overwhelmed. We can't just keep
correct.
looking at the numbers, Doc Ted. We also have to look at the capacity of the hospital. So I think a team of epidemiologists are there.
Yes,
Assessing the situation in Cebu. So it was really just basically that because it was densely populated. No other reason for the rise in the number of infections.
well, the only reason I can think of course, is the behavior of people, and then we discovered the home quarantine policy, wherein they were sent home. That could have contributed to the increase, and
Okay.
because it's the business started to go again at the GCQ. Maybe the transmission actually continued because there were undetected cases that were moving around. So for us, I think the most
All
important
right.
is to reverse that. And to reverse that, they were put on ECQ. The city was put back on ECQ.
Okay. So let me just go back to the numbers that we have, over 30,000 cases. So if I were to ask you, what is your assessment on that? Is that something that actually concerns you, or is this something that you are expecting?
Well, we call it the reproductive number, or R naught. And we were actually predicting this. Our team at UP, the bioinformatics COVID-19 pandemic response, we're saying we would reach about 30,000 by the end of June. And true enough, we've reached 30,000. We've reached it. And I think we still haven't really lowered the reproductive number. Is still hovering around 1. We want it to be less than 1, maybe 0.5 or even 0. So that's the target to go to. We need to do stricter. I think for the people in Manila or in Cebu, it is important that each individual really behaves, so that behaves with the procedures of social distancing, wearing face masks, hand washing, and no mass gathering events. These things will really lower the reproductive number, and hopefully our new cases will continue to decrease. I think for Manila, we're already decreasing the new cases.
So,
Metro Manila, but I think there are a couple of barangays that have some increases in the city of Manila. So that
yeah.
one will have to be what we call targeted lockdowns, wherein you try to contain it in that particular
Yeah.
area,
Oh.
so that economy can now continue.
So what you're seeing is a lowering of cases in Metro Manila, but there are still spikes in some barangays. Are you actually seeing a possible flattening of the curve soon, Doc? Or hindi pa rin po?
Can you repeat the question, Pinky?
Are you actually seeing a flattening of the curve soon? Are we on our way there? Or hindi pa rin po?
Yes, in Metro Manila, we were able to raise up the health system's capacity. So when you say the curve is flattened, it is below that capacity. That means when you go around the private hospitals now, only 20% of their COVID beds are occupied. I think the hospitals that have high COVID beds are PGH, because of the some sporadic
Right.
cases in Manila. But when I did the rounds of the private hospitals, their COVID cases are low, and they're beginning now to admit the regular cases that need hospitalization. So that's good. That means our capacity for any outbreak, we will be able to handle, and we will be handling them properly, because even the doctors are now well trained to wear PPEs, to how to do ventilatory support for patients, and you see more recoveries and more discharges happening in this past few days.
That's right. All right. So we still need to be careful. We still need to do what we've been saying over and over again. Dr. Ted Herbosa, sir, thank you so much for your time.
Thank you very much, Pinky.
Thank you. And coming up, more transportation options are being provided for commuters, but how will operators and authorities ensure that the public is safe from the coronavirus? Road Sector Senior Consultant to the Transportation Department, Bert Swansing, joins us live after the break. Please stay tuned.